If my child's really sick when the fever's there, but when the fever drops, they're running around singing, eating well, playing games and swinging on the swing, there's a reasonable chance that's more likely to be viral than bacterial. No guarantee, but a reasonable chance. The child who's sick when the fever's up and then when the fever comes down still looks awful, that's starting to worry that that's probably bacterial. But you can't rely on that differentiation. You've really got to seek medical opinion. But there's no doubt in hospital environments when we have a patient and they've got a high fever and we give them paracetamol and get their fever down, we are influenced immensely by how well that patient looks when the fever drops. And if they're singing and eating and playing games, they're not likely to have something terrible like meningitis, so we might watch them a bit longer rather than jump in and do lumbar punctures and things like that. When you think of infections such as pneumonia, usually that's associated with increased respiratory rate. They're breathing quickly, they almost always have a cough, they might be blue around the lips. Meningitis, the baby will have, or a child will have a stiff neck, a headache, will be lethargic, hard to arouse. But the great mimicker in paediatrics in infections is a urinary tract infection. And it mimics almost any condition in paediatrics, especially in babies under 12 months. Because it commonly presents with just a baby who's not gaining weight properly, a baby who's a bit more lethargic than usual and not feeding as well as they could, an irritable baby who's screaming a lot, where we think it's colic or we think it's heartburn from reflux. All babies, before you treat them with reflux medication, you need to say, well, does this baby have a urinary tract infection? Because it causes symptoms of irritability, causes symptoms of screaming, causes symptoms of vomiting. And they're symptoms of many other conditions. And in fact, urinary tract infections in babies under 1 almost invariably don't have symptoms of burning and scalding. So, you'll see little Harry weeing, and he might have an infection, and yet he's not screaming when he wees, unlike an adult, where they'll be complaining of pain. You can change the course of nature by thinking of a condition where that condition may not be out there, out in the open, and urinary tract infections are one of the ones that are very commonly missed. A lot of babies get infections behind the ears, and that's called seborrheic dermatitis, and that is the same as the cradle cap on the scalp, but it's moist, it's always moist, it's never dry and scaly, and they often need topical weak steroids, either hydrozole if there's a fungal infection, or an equivalent medication, or hydrocortisone, or one of those equivalent medications if it's not got a secondary fungal infection. And some children get a secondary bacterial infection. It's so moist that not only does a fungus get there, but a bacteria gets there. Now in those conditions, it can in fact be life-threatening because they can get a cellulitis, they can get an infection where it spreads along the tissues of the skin, and it's almost like not a welt, but it's under the skin, but it's spreading in a manner in which you can see it creeping very gradually, circumferentially around whatever, whether it be an infected mosquito bite, whether it be a cut, it doesn't matter what the cause is, it could be a sting from a bee or whatever. But they almost always, with very few exceptions, need intravenous antibiotics in hospital for a couple of days, get the infection under control, then they go home on another 7 to 10 days of oral antibiotics.